Hello, and welcome to Dr. Nguyen's YouTube channel. Today, we delve into the fascinating world of in vitro fertilization, commonly known as IVF. In the simplest of terms, IVF is a medical procedure that aids in the conception of a child. It's a beacon of hope for many who dream of starting or growing their family. But what really is IVF? It's a process where an egg is combined with sperm outside the body in a laboratory. Once an embryo or embryos form, they are then placed in the uterus. It's a procedure that has brought immense joy to millions around the globe, making parenthood a reality for those who've had difficulties conceiving naturally. Its significance is profound, bringing life-changing possibilities to prospective parents. It's a complex, yet utterly remarkable process. So, buckle up as we embark on this journey to demystify IVF together. IVF, in simple terms, is a process where an egg is combined with sperm outside the body. This medical technique, known as in vitro fertilization, or IVF for short, has revolutionized the game for couples struggling with infertility. It's like a dance, a beautifully choreographed sequence of steps, each crucial in its own way. The dance begins with the stimulation of the ovaries, encouraging them to produce multiple eggs. These eggs are then gently retrieved and introduced to sperm in a controlled lab environment. The meeting of egg and sperm forms an embryo, which is then transferred back into the woman's uterus, with the hope that it will implant and grow into a healthy baby. It's an intricate dance, one that requires precision, care, and a team of medical professionals to guide the process every step of the way. Now that we have a basic understanding of what IVF is, let's move on to why it's sometimes necessary. IVF isn't always the first choice for couples struggling with infertility. It's often viewed as a last resort pathway when other fertility treatments haven't worked. So, when might IVF be recommended? Well, there are several scenarios. For instance, women with blocked or damaged fallopian tubes, making it difficult or impossible for an egg to travel to the uterus, can benefit from IVF. Likewise, men with low sperm count or sperm mobility issues might find IVF helpful in their journey to parenthood. Age-related fertility issues are another common reason. As women age, the quality and quantity of their eggs can decrease, making natural conception more challenging. IVF can help by using donor eggs or embryos. Moreover, if a genetic disorder is a concern, IVF, combined with pre-implantation genetic testing, can allow embryos to be screened for certain genetic conditions before they're implanted. IVF can be a ray of hope for many. Now, let's see how it actually works. The IVF process, while complex, can be broken down into manageable steps. Let's walk through this journey from its humble beginning to its hopeful end. Our first step is the initial consultation. This is a crucial stage where you and your doctor discuss your medical history and explore the best treatment options. Don't hesitate to ask questions. This is your journey after all. Next comes the hormone treatment. Here you take medications that stimulate the ovaries to produce multiple mature eggs. This is because not all eggs will develop or fertilize after retrieval. The process is monitored closely using blood tests and ultrasound scans to ensure the eggs are growing as they should. Once the eggs have matured, we proceed to the egg retrieval stage. This is a minor surgical procedure where the eggs are collected from the ovaries. It's typically performed under sedation, so discomfort is minimal. We now move on to the laboratory, where the magic really happens. The eggs are combined with sperm in a petri dish, mimicking natural fertilization. If necessary, a single sperm may be injected directly into the egg, a process known as intracytoplasmic sperm injection, or ICSI. After fertilization, the eggs develop into embryos. These are monitored by embryologists for a few days to ensure they are growing correctly. The best 1 or 2 embryos are then selected for the next step. And finally, we arrive at embryo transfer. This is a simple, non-surgical procedure where the embryos are placed into the womb. It's a delicate process, carried out using a thin catheter. You're awake during the procedure, and it's generally painless. Now it's a waiting game. 2 weeks after the embryo transfer, a pregnancy test is performed to see if the procedure has been successful. And that, in a nutshell, is the IVF process. But how does one prepare for it? Preparation for IVF can be both physical and emotional. As we embark on this journey, it's essential to lay a strong foundation for success. One of the most critical aspects is maintaining a healthy lifestyle. That includes eating a balanced diet, staying active, and eliminating harmful habits like smoking and excessive alcohol intake. But it's not just about the physical. Emotional readiness is equally important. IVF can be a roller coaster ride of emotions, so it's vital to have a strong support network in place. That could be a supportive partner, a trusted friend, or a professional counselor. Then there's the financial aspect. IVF is a significant investment, and it's crucial to understand the potential costs up front. You may want to consider meeting with a financial advisor or doing your own research to prepare for these expenses. Preparation is key in this journey. But how much does this journey cost? The cost of IVF can vary significantly. It's a complex procedure with many variables that can impact the total price tag. One of the key factors is location. Costs can differ greatly from country to country, and even within regions of the same country. Moreover, the cost can also depend on the specific fertility clinic chosen, as each has its own pricing structure. The number of IVF cycles required is another significant cost driver. Some couples may achieve pregnancy on their first attempt, while others may need multiple cycles, which can quickly escalate the overall cost. Additionally, some might require extra treatments or medications that add to the bill. But remember, when considering the cost of IVF, it's also important to factor in the potential emotional costs, such as stress or anxiety. Despite the cost, many find IVF worth every penny, but like any medical procedure, it comes with risks. IVF, while generally safe, does come with potential risks. One of the most common risks is the possibility of multiple pregnancies. This can occur when more than one embryo is transferred to the uterus. While the idea of twins or triplets may be exciting for some, multiple pregnancies can lead to complications for both mother and babies. Another risk to consider is ovarian hyperstimulation syndrome. This condition, although rare, can occur when the drugs used to stimulate the ovaries work too well, leading to swollen and painful ovaries. It's important to note that this condition is usually mild and can be managed with close monitoring. Emotional stress is another factor that cannot be overlooked. The process of IVF can be physically and emotionally draining. It requires a significant time commitment, and the emotional toll of the potential for failure can weigh heavily. Knowledge of these risks helps in making informed decisions. And that's what this journey is all about, making informed decisions. We've covered a lot of ground today, from understanding what IVF is to the potential risks associated with it. We've journeyed together from the initial overview and illustration of the process to the specific indications for its use. We've walked step by step through the procedure, making sure you're well prepared for what's to come. We've also discussed the potential costs, which can vary widely but should always be considered in your decision. We didn't shy away from the risks either, because it's important to go into this process with eyes wide open. But remember, every journey has its bumps and hurdles. The road to parenthood through IVF may be complex, but it's a path well trodden by many before you. So whether you're just starting to explore your options or you're already deep into your journey, keep moving forward, keep learning, and keep your eyes on the prize. Thank you for joining us on this journey. Remember, every journey begins with a single step. Until next time, this is Dr. Nguyen, signing off.